Having an abnormal pap smear can certainly be a scary thing. However, should someone get a hysterectomy because of their abnormal pap smear? I get this question a lot from not only my own patients, but from people I see online. I see this question a lot. It can be the right answer in a select few situations. However, for the most part, it's really not the best answer. And we're going to talk about that in just a second. Again, my name is Eric Schmidt. I'm a board-certified OBGYN, minimally invasive gynecologic surgeon, and we're raising money for gynecologic cancer awareness. And there's a donation and a GoFundMe below. If you're able to give a few dollars, that would be great. But we're trying to get a goal of $500, and I'll match that if we get there. Well, a quick recap first. And I discuss a lot of HPV and PAP in other videos, so you can watch those for more. But basically, HPV infects the cervix, top of the vagina, and that's what causes almost all cervical cancers. But yes, it also infects the top of the vagina. And so when we do a hysterectomy and remove the cervix, there still might be residual HPV left over, which might need to be monitored and potential biopsied in the future. And so doing the hysterectomy doesn't always completely solve the issue. And the second point is that, well, a healthy immune system is kind of the mainstay for the treatment of these abnormal PAPs and HPV, is that a healthy immune system will eventually fight off the HPV. It's just a stubborn virus. It can take years potentially for this to happen, and we're going to watch you closely in that meantime because it's extremely rare that if someone's following up with us, that the HPV and abnormal PAPs actually turns to things like cancer, cervical cancer. And point number three is one where I think we need to do better in our own profession across the board as far as making it so that these procedures in the office are a better experience. Number one, educating, so patients are less afraid of these abnormal PAPs and these procedures, and it's explained well. And point number two is proper anesthesia and options. And so that's also a big talking point, and hopefully we're making big movements on making that the standard of care for not only this procedure, but a lot of women's health procedures. That being said, the main point for someone to get a hysterectomy because of abnormal PAPs is usually because they have recurrent high-grade disease that often they've had enough procedures called LEAP procedures or excisional procedures where removing enough of a specimen makes it difficult. So they've had repetitive procedures. They now have minimal cervix left. It's harder to safely perform that LEAP procedure or cone biopsy. And so those are often the situations where we might recommend hysterectomy for a potential solution for the abnormal PAPs. I hope this helps. We'll see you tomorrow for another video.